So the poster explains the entire programme. So the Health and Social Care Professionals programme was set up to fund new or innovative models of care. So we're looking at kind of new care pathways for men with prostate cancer, or just better use of existing resources and how we can kind of change that around so that men have access to the best possible care, the specialised care that they need in both primary and secondary care across the whole of their prostate cancer journey. So we've funded numerous roles, predominantly clinical nurse specialists, but there were also some physiotherapists, some occupational therapists, some radiographers. So we funded various kind of wide array of roles, and they've been involved in 44 projects across the UK. And yeah, there's been some really good positive findings. So we've just done the final evaluation of the programme itself. The kind of projects come to an end. And so the three kind of main key findings are that 94% of the men involved in the programme found that they had a much more improved kind of experience of the care they received from any kind of previous kind of cancer care and kind of treatment that they'd had before, which is a real positive. 97% of the men involved felt they could better kind of self-manage and better manage their condition because they were given more information, more support by their nurse specialist or their healthcare professional. And 88% of the men reported improvements in their physical condition, so improvements in sexual function, continence, and just general physical activity, not feeling as fatigued as previously. So the healthcare professionals involved, many of them set up completely new services where previously there wasn't anything prostate specific before. They were involved in various different initiatives, so there were information seminars for the men, so that they were much more informed about their condition, treatment options, consequences of the treatment, side effects that they would have by going through various different routes, so they could make a much more informed decision about which route they would like to take. There were living well days where they would get much more information on diet, nutrition and physical activity and how that could improve their recovery post-operative. There were rehabilitation sessions pre and post-operation as well, so the men could go through exercise regimes that would help reduce the time frame that they were incontinent post-operation, and also help with their sexual function as well, in kind of reducing the amount of time they were kind of having problems in that with that kind of area of their life. So.